we're going to talk about that RN to BSN degree track. So this is specifically intended for those that have an associate degree in nursing or are working on that associate degree in nursing to be able to come and complete that degree to get their bachelor's degree. Tonight, you're mostly going to hear from three of us. I'm Jessica. I am the Associate Dean of Enrollment and Communication. So I'll kind of be hosting tonight's session and then hosting our Q&A at the end. You're going to hear from Heather Mays. Heather is the admission counselor assigned for this program. So at the end, when we have specific follow-up questions, whether you've already been admitted or you still have questions about the application process, Heather is your go-to person to help out with all of those steps. You'll hear from her at the end. And then right now, I'm going to kick it off with Lisa spending the next couple minutes overviewing the whole program. So Lisa is the degree track chair for the RN to BSN program. Lisa's going to walk us through what is this program, how many credits, just everything about it. So you guys kind of understand the RN to BSN program here at Kettering College. And then, like I said, put all your chats in the comments if you'd like. And at the end, we're going to do a little Q&A with any questions that were answered through our presentation tonight. So super glad you all joined. Please know that tonight's session will be recorded. So for sure, if there's people we want to email this to or send it to, we're going to record tonight's session so that we can get this out to anyone that couldn't attend as well. Or if you want to go back and review this later, don't worry, it'll be recorded and we'll send you guys the link. All right, Lisa, why don't you go ahead and walk us through the program?
Okay, well, thank you and welcome to you all. I'll add my welcome and I'm glad you could join us. And I'm very privileged to be able to have a few minutes of your time. What I'd like to do is do a brief overview and then go through some specifics. Maybe if you've already applied to the program and want to know a little bit more specifics, I'll add a few more of them towards the end. And then of course, we'll answer questions, any questions that you have. But just wanted to quickly say, you know, this first picture kind of shows Kettering College. If you did not know that Kettering College was actually on the campus of our main hospital, Kettering Health, Kettering Medical Center. And so that's what's behind here in the back here in the background. But right here, you can see our big sign of Kettering College, and we have the entrance here, the main entrance. And though we are small, we like to say we are mighty. We offer a variety of healthcare degrees, and the RN to BSN track is one of those healthcare degrees that we offer. So we are celebrating, the RN to BSN program is celebrating a 20-year anniversary this year. We've been offering this degree now for 20 years, so that speaks to our experience, that we've worked all the bugs out. We're not a new program or anything like that. We are a well-established program, and listed here are just some of the recognition awards that we have gotten for our degree and Kettering College itself, so that you know that Kettering College also has a very good reputation. The one I'm proudest of here on this list is that top one, that we are ranked number 4 in Ohio. We were ranked number 4 this year by students. That is a ranking by students, not by faculty or by any sort of business or anything like that. It is from students. So that's the one we're most proud of. But also know that we have good quality in our program, and we've been in the top 20 ranking, in the top 20 in Ohio for the last 4 years running. So that speaks a little bit to our quality. Another measurement of our quality, of course, that you're most interested in is, are you accredited? Because if this program was not accredited, then that means that you might not be able to get credit as you went on if you have any aspirations to go on in your degree after a bachelor's, like for a master's or something like that. So we are accredited by ASIN, the International Nursing Association. And then we also were early adopters of Quality Matters. Now, some of you might be more familiar with things like JCO or, you know, those kind of accrediting bodies, HVAP or something like that, accrediting bodies that are for hospitals. And we have them on the education side too. Now, Quality Matters is an international one that sets evidence-based standards for quality. And so, and it's specifically for higher education, and it's specifically for online higher education. And we were early adopters of that way back when we started the program, and we've been following those evidence-based standards ever since. So again, that just speaks to our quality. So what I'd like to do next is just to answer some frequently asked questions that we get. So the first one usually is, can I transfer in any credits? And the resounding answer is yes, you can. We take your total associate's degree or its equivalent if you happen to have a diploma. Then we bring in a block transfer credit of 77 credits for your degree or your diploma. And we have usually a bachelor's degree requires somewhere between 120 and 125 credit hours. And so 77 of that would be your associate's degree. So then on top of that, you can transfer in 18 additional credit hours. And those are things that would be like statistics, pathophysiology, humanities courses like histories, languages, religion courses. If you've ever taken religion courses before, those kind of things would be what you can transfer in an additional 18 credits. The only thing that we ask, and this is standard across most higher education institutions, is that you must complete 30 credits here at Kettering College in order for us to give you a degree. Okay, but all the rest we can work on transferring in. How long will it take is usually the next question we get. Well, how long is it going to take me to get this? If you go full time, that would be taking a 12 to 16 credit hour load. Then you could do it in 3 semesters. You could do it in 1 year. However, you being a person that's probably going to be working, maybe starting a family or have family or those kinds of things that you need to have some work-life balance, most of you will decide probably go more on a part-time basis, and that's probably what you're interested in where you take 6 to 7 credit hours per semester. And the way we have our program designed is that it is in 7-week format, a 7-week format. So you take one course over 7 weeks, and we are on semester. So that means you can still take 2 courses every semester, one the first 7 weeks, one the second 7 weeks. And you're able to get 2 courses done per semester. Okay, so that allows you to go through the degree quicker. We do have admission entry 3 times per year. So you can start in January, you can start in May, or you can start in August, September, whenever the academic calendar starts there. And so you can, we start those 3 times a year. There are 16 courses basically that are required for a bachelor's degree in our curriculum after your associate's degree. So it's only 16 courses. There are 8 arts and science courses in our curriculum and 8 nursing courses. And I'm going to go through those, show those a little later in the presentation. Okay. So if you go full-time, you could complete the degree in as little as 1 year. And if you go part-time, it usually takes about 2 to just 2 years, maybe one semester over, that kind of thing. Next question, what will it cost me? Okay, so we are very fortunate to have a partnership with Kettering Health. And they value us, and they value having nurses that attain a bachelor's degree. So in a partnership with them, we were able to reduce our tuition rate. You see there, it was $576 per credit hour. And for anybody who wants to come to Kettering College now and enroll in the online RN-to-BSN degree, it's $325 a credit hour, which is phenomenal for a private Christian school. Okay, so that's a great credit hour rate. So anybody, you don't have to be a Kettering Health employee. Okay, so if you're not employed at Kettering Health, you can come here and get that rate. If, however, you are a Kettering Health employee and do want to work for Kettering Health, you can apply for education assistance after a 6-month period of employment, and you will get an additional $75 per credit hour discount, which brings your rate to around $250 per credit hour. So that's just a great rate. But I have even better news. But let me just get through this one slide first. Those of you who would not be Kettering Health employees, this is kind of what it would cost at a $325 credit hour if you had to take every single class without any transfer credit other than your associate's degree. Okay, so this would be less if you had transfer credit, like you brought in a statistics course, you brought in a humanities course, then of course your dollar amount would come down. But the most amount you would pay would be a little over $16,000 for your bachelor's degree. Okay. However, this, I just switched the slide. This would be with the cost for a KH employee who gets educational assistance after that 6-month period, the cost for your total degree would be $12,000. However, the really, really good news is that if you're a KH employee, you get that educational assistance, Kettering Health is going to actually pay for this degree for you. So essentially it will be free. Okay, you of course sign a contract that you are going to work off those hours as you go. So you pay back in time, okay, them paying for that degree, but they will actually pay for this degree and it will be of no cost to you, virtually no cost to you. So that's a really good thing if you're a Kettering Health employee, and we're excited to be able to offer that to you. So how do you get started? Basically, all you need to do is apply. Go to kc.edu, and any page that you come onto will have some sort of apply button or someplace where you can click on and it'll take you to an application. It's a very simple process and should only take a few minutes to fill out some initial information, some contact information, and Heather will be able to tell you a little bit more about that if you have any questions about how to complete that application process, but it's not difficult. And then after you apply and we get your application, then Heather will connect you to an advisor. We're going to connect you to all the resources that you need, get you set up on email, and then you simply register and you begin to learn. So it's a very simple 3-step process that we get you in. We try to make it as simple as possible. Heather does a great job in facilitating that admission process, and then you get in and get learning right away whenever you choose to start in any of those 3 entry points. So this is the curriculum that I said I would go into a little bit more for those of you who may have already applied and are accepted. These are the nursing core courses that you would take. These are the 8 courses. And everyone starts with that first 3 course, the 313 course with BSN Success Strategies and Informatics. Kind of walks you through getting started online again. And if some of you have not been used to being in school for a little while, this will help get you back into the groove, get you back into the idea of writing and how to express yourself in the writing format, because every single one of our courses are completely online. You never have to come to campus to complete this degree. So it's just a great format for you to be able to do this. So it's 24 credit hours. The other 24 credit hours that again, you can transfer up to 18 credit hours as the arts and sciences. But you can see here we have some theories, research, issues and trends in nursing, health promotion. We have 2 courses that have practicum in them, and those are 12 hours, approximately 12 hours to complete each practicum. One is a focus on community and service. The other is a focus on leadership. And those are, like I say, about 12 hours. If you are taking this degree out of state, like some of you are from Tennessee, and I have no idea whether you're planning on staying in Tennessee or not, but we could try to arrange your practicum in your home state if we can sign an agreement with that. If we can't get an agreement, then you might just have to visit us in Ohio and come see Kettering campus and do your practicum with us, which we would love to see, to be able to see you and meet you in person as well. And then finally is the senior capstone, which is a 1 credit hour course. It's a portfolio. It's an academic portfolio that you will be accumulating all the way through. From your first course, you're going to start your portfolio and you will be adding to that as you go through the curriculum. And then you will finish that up in the last capstone course to be able to present that to an employer potentially, or use it to go into a further degree if you needed to, something like that. And that basically is our curriculum. Finally, I just wanted to say a word about our graduates. The feedback we get from those who have our graduates in employment have used these terms to say the characteristics and the qualities that they see in our graduates. And so we are very proud of that we are able to instill these or bring them out a little more if you already have these qualities, and just make them a strength for you as you go into your professional practice. And that really ends my portion. So I'd be happy to take questions, or if you have anything else, Jessica, that you would like to have Heather speak to.
Yeah, no, that was great. Thanks for running over that. So we definitely want to open it up for some questions right now. And I'm going to kind of go into some details depending on what you guys are interested in hearing about. So in the chat, you can go ahead and list any questions that you'd like. Go ahead and start. Also note, we do have Brandy on the call tonight as well. So if you are a Kettering Health employee, everything that Lisa just talked about with Kettering Health employee benefits, between Heather and Brandy, the two of them would be the team to make sure you move through, do the process you need to make sure that you apply for that correctly, etc. So if we have questions about that, we can go into it as well. What I'd kind of like to kick us off with a first question, I don't see any coming in yet, so I do want to have Heather speak to this a little bit. We kind of have two groups of people on our call tonight. So one group are people who haven't applied, and it looks like you guys are just kind of checking out the program, seeing if it's the right fit for you. And then we have a couple people on the call that have applied and they're admitted and they're ready to start this winter semester. So I'd like to just really high level, Heather, with both of those groups, what should the first steps be for those that are ready to apply? Where do they get started? How can you connect with them if they're ready to apply? Versus the group that has already been admitted. And if they're ready, what does that next step look like to work with you?
Yeah, sure, no problem. So for those who have not applied yet, first step, as Lisa said, was to go onto our website, kc.edu, and apply. It's super easy. The button's right there for you. It's free, so there's no fee that you have to pay for it. Takes a few minutes to fill out. Next step is that we would need transcripts from everywhere that you've been sent to Kettering College. For them to be official, they do need to come from your school directly to Kettering College. They cannot be sent by you to the school. They have to come officially from them. So that would be your first step. Once you received your transcript, your application would be complete and it would go on for program review. Those who have already applied and who are admitted, your first step, if you're a KHN employee and you're going to use education assistance, is to have watched the Health Streams tutorial that was set up for you, and then to do the application. If you've already done your first application and you've registered for classes, your next step is to fill out your subsequent application. You can find the knowledge base article on how to fill that out in and under your My HR area. It should be in the search. You just type in KH and then education assistance, and it'll give you all the education assistance articles. So those are your different steps. If you've got questions on them, let me know.
Any questions, guys? Are we so thorough in our presentation that no one has questions? Because if so, then we're doing something right. But we also want to be able to answer anything that you guys might want to know about this program, because that's what we're here for. I will say, Heather, can you put your email in the chat?
Yeah.
So you all see Lisa's email. She is the degree track chair. So she's the program chair of over RN-to-BSN. But I do want Heather to put her email in the chat as well, because if you guys feel like you're getting stuck in the application process, or what she just ran over for Kettering Health employees, if you want to make sure to take advantage of those benefits, it's awesome. Apply for them. Between Brandy and Heather, the two of them you take that health streams, it'll walk you through everything, and then you can take advantage of the benefits. But if you're stuck, like you're not able to find it or something, Heather's email is right there in the chat. And so she can help connect you. The other thing too, that Lisa kind of mentioned is once you're admitted, we connect you with your advisor right away. So the admit process is only a two-step process. Give us your application, give us your transcripts. Once that's done, we connect you right away with your faculty advisor. So Heather will make sure you know who that advisor is, because the first time you're registering for classes, for the group of you guys that are ready to start this winter, that's what we can do right now. Registration opened last week. So we can get you your faculty advisor. Heather can make sure you connect. You guys can make sure to sign up for the right classes, make sure all of your employee benefits, the application is done. You guys did that correctly, because then you're going to be ready to start classes. I believe classes start on January 10. So a couple notes about that. If you guys are interested in starting this winter and you haven't applied yet, there still is time. We could process your application this month, get you in, get you admitted, work out the tuition assistance if you take advantage, or the education assistance through Kettering Health if you take advantage of that. There is still time, because we're still in the window of registration being open. And then your classes would start on January 10. If you're somebody who's like, whoa, that's way too soon for me to start, my life isn't in order yet to be able to jump into classes right away, Lisa already mentioned you could start in May or fall, and those applications are open already as well. So you could apply and start the paperwork, but you would have a lot longer to kind of finish out the rest of it. All right, we have one question that came in here. I'm going to read it out loud, and let most likely Heather here. I'm going to let you or Brandy answer this. What is the structure or length of the contract for employees that are working off financial assistance provided by Kettering Health?
So once you have started the education assistance program after you graduate, the length of time, it goes into hours worked. So it's about 2,080 hours of working time that pays off what you've used. So I don't want to say it's like 2 years, it's a little under a year. It depends on what shifts you take, what hours you have, how long you work it off. That's also stated in the policy. So if you go under your My HR in the knowledge base area, if you type in policy, KH education assistance, it's going to come up, and that's all written in there, the commitment hours and everything. So I would suggest, yeah, looking into that. It's going to write them out for you.
Yeah, great. Thanks, Heather. And Brandy did make a note. She said for most people, it's about 1 year. And you're right, Heather, it all depends on the shifts you have, because they calculate it based on hours. So that's true. So if any of you aren't Kettering Health employees and you'd like to be, we have a career services director. We can get that started so you can take advantage of the benefits. But like we said, you don't have to be a KHN employee, because we did work on that tuition being much lower for anybody. However, to take advantage of those benefits, then you would just have that 1 year contract after to pay off that time. Okay, so we have one more question here. There's a stats course that we need to submit the syllabus to have it evaluated. Who should I send this to? Heather or Lisa, would this go to the transfer credit team?
So come to me first. So send the syllabus to me first. I'm going to consult with transfer credit. Sometimes if it's a stats class, we have to take it back to the math science department to kind of look over. So send it to me first, and I'll figure out kind of where it goes.
Great. So you can write that same email, heather.mays@kc.edu. Or if you don't know who to talk to and you're saying do I talk to Heather? Do I talk to Lisa? Do I talk to Jessica? I just put in the chat the general admissions email. So admissions@kc.edu. That gets you to the general admissions team where both Heather and I work. We are really great at connecting you with the people you need to work with. We're like masters at it. So if you aren't sure where to start for any questions at Kettering, start there, and then we can always help get you where you need to go. All right, so there's another question here. Is the time served counted in your hours at all, or rather, I should say time worked? So Catherine, let me make sure I'm understanding your question. So you're saying to pay back the time through the education assistance, are you asking if that is counted up in hours to pay back that tuition assistance? You can clarify. Okay. So yeah, so Heather and Brandy, if you guys want to weigh in, is that correct that they count it based on hours, not necessarily like a calendar year? Is that correct?
Sorry, I was trying to find my unmute button. Yes, it just goes by the hours worked. So it won't, and now I'm trying to go for my BSN. No, it's from those hours that start working. Sorry, this is the end of my day and my brain's a little fuzzy. The hours start counting either after graduation or day of last payment, whichever one comes last. So it would not start until after you are no longer using education assistance, you're done, you're finished, and you have your BSN. No problem.
Great. I think I saw a hand raised a little bit. Did I answer the question of whoever had raised their hand in the chat? You can definitely unmute yourself if you have a question you want to ask. Okay, I figure out. Okay, awesome. I see the message here coming through the chat. No problem. We are all in a world where we're learning how to interact on Zoom. It's okay. So great. So we seem to answer your question. Okay, so anything else? Again, we talked about start dates. It is a great program. I've talked to a number of employees that have gone through. Lisa, one last thing, unless no other questions come in, if you can speak a little bit to this, Lisa. I hear from students all the time that are looking to go back to school, that they're worried about the part-time, full-time. What do I do if I need to drop out for a semester? What happens if life gets in the way? Can you speak a little bit to that flexibility that students have to choose semester to semester?
Sure. We have a fairly flexible program in that if life does occur and you do need to step back and drop a class, then you definitely can do that, but that does not then halt your progression, because we don't have a lockstep type of a curriculum. So you can go on, and if things clear up in a couple weeks, then you can go ahead and register and take the next class, and then pick up when it comes back around the next time, the class that you had to drop. So that's how that would go. And we have an excellent team that really tries to work with you and give extensions where we can, and really try to work personally with you. That's the beauty of being a smaller college, is that we treat you as an individual and not as a number. So that's one of the things that I'm really proud of the faculty that I supervise, so that we're able to do that in the program for you.
Yeah, that's great. Thanks, Lisa. All right, one last chance. I want to make sure we caught every question. You guys have been awesome for joining us tonight. Any last questions that you guys want to either unmute and ask or put in the chat for us tonight? All right, I guess we've done our job well then. So yeah, just to reiterate, like Lisa said, this program is made for working adults. So we try to make sure we're just pacing it at the life of an RN. So if you're deciding to work while you're in school, that's why we have those 7-week courses. That's why you can work with your team on those things. That's why it's online. We have one more question before I wrap up. Is it possible to see a curriculum map to graduate in 2 years? So Lisa, you may not have the visuals, but can you talk through what that curriculum map looks like if it's spread out? And then also, Anthony, that's a great question. If you have Lisa and Heather's email, we can also send you a link to like an advising sheet or something like that to show you what that looks like as well, if we want to connect that way as well. Lisa, can you speak to that question a little bit they ask, is it possible to see a curriculum map to graduate in 2 years? So what does that look like?
Sure. Since we are in a 7-week format for each course, that means that you can take 2 courses each semester. So for you're going to have to take at least the 8 nursing courses, and that last senior capstone is offered every semester. So it won't ever, you can always graduate every semester, just like you can start every semester. So that last senior capstone, which I don't know whether you remember, it was 1 credit hour, that can get piggybacked in with whatever last course that you are taking, your nursing course. So what that would look like would be, you would take 2 courses each semester, 1 7A session, 1 in the 7-week B session, okay? And then you would continue taking that. You would take those 8 courses, and that would take you, just taking the nursing courses would take you through 4 semesters. So that's just a little over a year. Then we would add in any other arts and science courses that you did not transfer in. And so you would, and again, those are offered in 7-week sessions. And so you would take 2 of those every semester. And so you would just add on 1 semester for every 2 of the arts and science courses that you needed to take. Did I explain that? Okay, so I mean, the minimum number is just a little over a year that you would take part-time courses. It would be basically 4 semesters for those 8 courses, okay? And then anything else would be added on, would add on the time to graduation, just to complete your arts and sciences necessary for the degree. Did I explain that okay, Jessica, Heather? Was that clear? Is there any, okay.
Yeah, and we
Anthony?
also put a link to our curriculum page too. So if you want a visual for it, you guys can follow the link to that curriculum page. So yeah, definitely, again, understanding those 7A, 7B courses, that's kind of how Kettering College functions, where you have a traditional fall semester, winter semester, and summer semester, but within that semester, you have those 7A, 7B courses because you're splitting them into those modules. So you're exactly right, Lisa. Depending on how fast, either you're part-time or full-time, that course load looks different.
Right. And most people who are working can't handle a full-time load, just because the 7 weeks allows you to take 2 courses to semester, but to focus on 1 at a time. So that way you're not trying to manage 2 courses at the same time and trying to juggle, oh, which assignment is due? Oh, I've got another discussion due. I've got 3 discussions due this week, because I'm carrying 2 courses. So that helps you to focus on 1 at a time and get it done in a timely manner. That way. But if you were full-time, then you could finish, you could finish, I think, in just the 3 semesters, I mean, you could, in less than a year, you could get everything done. But that's quite a load. That's taking 12 to 16 credit hours a semester, and that's quite a load. So that would be that.
Lisa,
I haven't had anybody do that, to tell you the truth.
Wouldn't you say, Lisa, that a student could connect with their academic advisor at the start of the semester and kind of talk through that load a little bit if they were unsure?
Absolutely. We highly recommend that you actually touch base with your academic advisor every semester to plan through what you're going to take in the following semesters, and to see if anything has changed with what your plan is or what you can handle as far as your load, that kind of thing. So definitely talking to your academic advisor every semester and just touching base and saying, hey, this is what I'm planning on taking. What do you think? Am I on track for graduation? And that just helps confirm and make sure everybody's on the same page. Yeah, and get you what you want. Yeah.
That's a really, really good point. So for sure, any of you on the call tonight that are already admitted, Heather can connect you with that academic advisor, and may have already, depending on where you're at. So if you want to know who that academic advisor is, now is the perfect time of year. Make contact with them right now, or they will contact you. Heather will get you in touch. Between that, as long as you guys connect, then you're going to be able to register for your classes right now, finish up everything you need to be ready to start. So it's the perfect time to make that connection if you're starting in winter. If you're, oh, go ahead, Lisa.
No, I was just going to add in that all of our academic advisors are faculty in the program. So they teach in the program and so are very well versed in how to get you through the program. So since they all teach in it.
Yeah, that's great. And then if you haven't been admitted yet, and you're just seeing if this is the program for you, when should I start? How do I apply? The next step for you is you can get in touch with us after this if you have more questions, if you need more clarity. Again, you have Lisa's email right there on the screen. Heather's email, she's put in the chat. It's heather.mays@kc.edu, or you can reach out to the admissions@kc.edu. So if you're saying, I didn't quite get all my questions answered tonight, or maybe I have this specific question that I need help with and you haven't been admitted yet, your first step is we're going to get you in touch with Heather. We're going to get you walked through the application process. And then once you've been admitted, especially if you're a Kettering Health Network employee or want to become one, that's when Brandy and Heather will get you into that health streams, get you your education assistance. We have time before the winter semester if you want to start now, or like I said before, summer or fall is just fine as well. So if there's no other questions, last chance. Everyone has one more chance. If you have anything else you'd like to know tonight. Nope, I'm not seeing anything coming in the chat. All right, so we're going to wrap up tonight. You guys have been awesome. Thank you so much for joining. You'll get a copy of this recording within the next week or so, probably at the end of next week. Heather will be reaching out with a link. So if you're wanting to share this with coworkers or review anything one more time, Heather will send the link to this recording sometime next week. And other than that, you guys have been awesome. So I really hope we get to see you at Kettering College. I know Lisa's ready to connect with you in her program. Heather's ready to work with you on any admission steps that you need help with. So it's just been awesome to see all of your names on our screen tonight, and we hope to see you at Kettering College soon. Thank you all for joining us. Have a good evening.